Good morning. We're now joined in studio today by Jacob Zammit. Welcome, Jacob.
Hi, Janelle. Thank you.
Thanks for joining us today. Jacob is here. I'm going to let you kind of intro everything, but just a little teaser is he's here to talk about a new and kind of exciting project that's happening here right in Howell.
Yeah, thank you again. My name is Jacob Zammit. I'm a lifetime resident of Livingston County. I've been here for about 30 years. My firm that I work with is Avison Commercial Real Estate, so we handle commercial real estate transactions of all types. We do sales, lease administration, dispositions, and in opportunities like this, we help represent landlords in filling vacancies for new products and new redevelopments that are going to be happening.
So redevelopments, it's kind of just takes us into our next point here because we're talking about a very specific space that has really been in the community for a long time. And do you want to just share a little bit about the building that we're discussing today and kind of what you're calling it?
Yeah, so the building we're talking about is the 645 West Grand River building, probably most lately known as the Citizens Insurance Building off Michigan Ave in Howell, just outside of downtown. The project we're working to do now is we're working to convert the project from what has been historically a single tenant owner-user office building to a new multi-tenant medical office building. I'm calling it the Howell Health Hub. So it'll have a name here that'll resonate with the local community. And the goal is to bring a lot of the medical care that typically patients here in Livingston County have been seeking outside of county lines, whether that be south on 23 headed to Ann Arbor or east on 96 heading to Novi. We think this project and the building is a pillar of the community given that it's been here since the 50s, and we'd love to find a way to breathe some new life into what's otherwise been an underwhelming crown jewel.
Absolutely, yeah, and this is exciting. I know that as we've been kind of talking with people out in the community, people can see what's going on, but we really haven't, there's movement over there. I know you guys are doing some parking lot upgrades right now. So I would love it if you could share a little bit with our listeners that kind of some of the improvements that you guys are currently working on and what you anticipate in the next coming months.
Yeah, so we currently have over $3 million in renovations planned. It'll be everything from refacading the entire front of the building that you see as you go by on Michigan Ave to a whole new atrium and lobby in the back. Actually, if you drive by there now, you'll see we've ripped out a lot of the concrete to your point. The parking lot's going to be completely stripped, restriped, and redone. We've got well over 400 parking spaces to accommodate, a myriad of different users. As of right now, we're kind of seeing the project as one that's going to be healthcare system agnostic, which differs a little bit to a lot of the medical office buildings in the relative proximity. More often than not, you have a primary healthcare system and the doctors affiliated with that healthcare system all operating in the same building. With the Howell Health Hub, we think it's a unique opportunity given that we don't have any healthcare use restrictions on practice types provided by a hospital. So we think there's potential where you could have Trinity doctors, Ascension doctors, independent physicians, McLaren doctors, U of M, and so on and so forth, all operating under the same roof. The property is really well positioned. It's got great exposure. We've got new signage that's being ordered currently. We've got over 109,000 square feet that'll be available on 3 floors. We've got nice, big 35,000 square foot open floor plates that are ready to be transformed. And as part of kind of the early unveiling, while that atrium's being built out in the rear, we're going to have what we're calling a model suite being built out so that as tenants want to walk through and see, what is this building going to look like, or what can I picture being here as a prospective tenant, doctors will be able to have a sample space to come in, walk around, see the finishes, the colors, select what makes the most sense for them and what aligns best for their practice. And then we, with ownership, will work on building out the practice to kind of fit their perfect mold.
So all of the different spaces available within the building are essentially customizable.
Correct, 100% customizable, and we've kind of left it very open, knowing that we could be getting inquiries from orthopedic groups, we could be getting interest from urgent care centers, we could be looking at people who want to have surgical suites within the building.
What about like medical spa?
Medical spa, anything wellness related. We've had some behavioral health interest early on. We think anything health or wellness related will have great synergy within the practice, and I suspect as it fills up there may be some ancillary amenities to the tenants that'll infill as well, whether it be like a smoothie bar, or if you have a physical therapy, maybe we'll have a prosthetics provider in there. We're really going to make it so that the practices in there benefit from each other, and that there's synergy amongst the tenants in the same building rather than competition.
Absolutely, that makes a lot of sense. I love the way that you guys are being so thoughtful in that approach, and making sure that you're also not only providing value to the community, but value to the tenants that are going to be in that space.
And 100% to your point, we feel it really has to go both ways. As I mentioned, I'm a lifetime resident of Livingston County in the city of Howell. I went to my early elementary and middle school days just down the road. I know the area like the back of my hand, but I also remember in my youth as a patient, and my parents were looking to take us, my brother and I, for different practices or different appointments. We were constantly veering outside the Livingston County boundary, and so we'd love to find a way to keep not only some of the local patients here at ease with having service providers that they can go and see locally, and not having to kind of stretch that drive to 30 minutes plus.
Yeah, especially kids. They don't like spending time in the car.
Yeah, nobody does. Nobody
No.
does, and especially with that mess on 96. So
Exactly.
if we can bring everything here and make it so that it benefits the local community, it benefits providers here in the area, and benefits patients, we think that would be a slam dunk.
Awesome. Yeah, I couldn't agree more. And I think that there's a lot of positivity to this project. But specifically, could you talk about some of the positive impact this project might have just on Howell as a whole?
Yeah, so here in Howell, what we have is we have an aging demographic. I think the 51 to 65 and up resident age gap is the second largest demographic per growth here in the local community. And so, as we see more and more younger families filling in, we also see the slow age up of population that have been here for the past 10, 20, 30 years. And as those patients age up, again, we think it's important for them to have somewhere local, and for the doctors here locally that may otherwise be traveling outside of county lines to work with their health system, we want to afford them an option where they maybe don't have to make that 30-mile commute. And so, what's long-standing been a building that we think people may have passed by without knowing the better, we're really hoping to drive attention, and we think some of these new improvements, you'll see a lot of the new construction work going on here in the next couple months. And we look forward to welcoming residents to the back to what's otherwise been an underserved building here.
Absolutely. And really, therefore, adding to a lot of the workforce and the healthcare sector in Livingston County. I don't know if you want to speak to that a little bit.
Yeah, so healthcare, I think, is the third largest employer by segment here in Livingston County, and that's just behind, manufacturing and public service. So we know there are a lot of doctors, not only that live here, but again, speaking to the resounding amount of patients that we have dwelling in the local community. And that's not to say that, again, with Howell, we could touch patients that are in Fowlerville or Weberville, some of the neighboring communities that go just to the north as well, or Heartland and Fenton. We really see this as being an agnostic healthcare hub central to the community here in Livingston County, and we invite all potential practices, patients, to please let your providers know that we have an option here, and we're going to have a ton of space to fill.
So, and I know you touched on this a little bit, but I was wondering if you could maybe expand or provide some more specifics on what we're referring to as the fleet for quality healthcare.
Yes. So more often than not, you have patients here in the community that get comfortable with a practice provider, and that practice provider may sign up with a new hospital system. And that hospital system oftentimes is going to dictate where that practice provider needs to be in order to serve the hospital system or the healthcare system's patients. What we want to do is afford a little bit more flexibility and also open our doors to healthcare systems on both sides of the aisle, right? I mean, I don't think for long since we've had this situation where if you're an Ascension patient, you're going to an Ascension building full of Ascension doctors. Nowadays, patients want flexibility, and if their insurance providers covers, payments towards multiple different healthcare systems, we don't want location to be the one reason that you feel stuck seeing one particular doctor. To that end, there are a lot of private practices that operate independent of a healthcare system. We want to afford those groups the same market entry that a lot of the healthcare systems right now benefit from, purely based on size and scale. So We think it's going to be a great opportunity here in the community. We're very open. We don't have any real firm plans on how the building is going to fill. We're kind of going to leave it to be organic, but we're going to do our best as inquiries come in and as groups start to sign leases to make sure that there is synergy amongst the groups and that we're not having a ton of competition within the four walls of the building.
Absolutely. Well, and I think too, one of the things that we haven't touched on yet is the kind of the access and the need for mental health and assistance and support. So that's a whole nother area that this site could serve as well.
Correct. Mental health, behavioral health. We've seen in the last couple decades a large uptick in the amount of autism cases. We've already had a couple of groups reach out to us about potentially getting space vacancy for a large autism center here, whether it be for children's, for adults, or for both. We have ways that we can accommodate these types of users without really prohibiting the flow of patients from other practices, while still keeping it relatively siloed and keeping everyone on the same campus. We think there's a benefit to that, and if all goes well, I think you'll see this become more of not just a health hub, but a health and wellness hub.
Mm-hmm. Absolutely. Yeah, no, that would be fantastic. I think it sounds like a great asset. I love the fact that you guys are really putting a lot of time, thought, and effort into these renovations that you're doing, and this whole rethought, reuse,
Yes.
repurpose.
And with a building at over 100,000 square feet, and we're not necessarily gearing ourselves towards one single user, we know there are going to be some growing pains that come with it. We expect that, and that's why I think with a great owner behind us, and Joe and Aquira Realty has been very active and very collaborative with us on the leasing efforts in terms of how we market this property. And then I think when it comes down to getting providers through the building and getting them an idea of what they can expect to see, we're hoping that the spec suite will do a lot in terms of giving that image and not requiring to leave it all up to imagination.
Absolutely, and I mean, you guys also have some really great resources on your website to demonstrate some of the improvements that you're making. I didn't know if that was something that you could share that URL today. Or?
Definitely. So thank you again. We invite everyone to check out our website at howellhealthhub.com. That's howellhealthhub.com. There you'll see kind of some of the critical infrastructure that the building is host to. We've got full building backup generator. We've got redundant power feed. So redundant power feed, you never lose power on site, and if you do, all it does is it switches so that you're pulling off a different transformer in town. The building backup generator, in case you have any kind of data or critical infrastructure that needs to be supported in the back end. And then we'll also have some tenant improvement packages to help as groups are signing these leases. The landlord's going to contribute so that we can help get that space built out and it's not all coming out of pocket.
Awesome. Well, we're really excited to see this kind of develop and throughout the process, so we'll keep all of our listeners engaged on that. But thank you for joining us today.
Thank you, Janelle. I appreciate you having us.